Today, I am proud to launch the inaugural KP Center webinar series, the first webinar featuring lessons from the field, discussions with a group of our recent grantees who will share with us the impact of research on their violence prevention work. Next slide, please. Firearm violence is a critical public health problem and a preventable one. And at the KP Center for Gun Violence Research and Education, we are committed to addressing firearm violence as a public health issue, supporting evidence-based, equity-centered, and community-informed approaches to addressing violence. This new webinar series reflects this commitment. The series is designed to support the capacity, confidence, and visibility of researchers and practitioners working to prevent firearm-related violence. We have had the opportunity to learn from our grantees about their research and evaluation training priorities in several ways. Beyond our research liaisons working with them to support their projects, our grantees have also participated in a survey that helped us identify training priorities within the group that we think are also relevant to the broader field. This webinar series seeks to address those priorities by providing practical and timely information on a range of subjects. And speaking of timely, I also want to remind you that we are still accepting applications for the 2025 funding opportunity. Applications are actually due next week on September 3rd, so you can learn more by visiting our website, kpcenterforgunviolenceresearch.org. This webinar series is just the beginning. It's just the beginning of fulfilling our commitment to education as a center, bridging the gap between research and practice as we work to reduce firearm-related violence. Next slide, please. We will be holding a new webinar every other month, covering the topics that you see here listed on the screen. Each session will have 2 speakers with experience in both research and practice who will share insights and best practices on each topic. This webinar series is being co-led by Dr. Tom Simon, our KP Center Senior Scientific Advisor, and Dr. Ruth Abaya, our KP Center Senior Clinical Advisor. They will be taking turns facilitating the sessions. Thank you for joining us in this first session of our inaugural webinar series, and thank you for all that you do to prevent firearm-related violence. Now I'll pass it on to Dr. Abaya, who is going to facilitate today's session.
Thank you so much, Dr. Mercado. It's wonderful to be here with all of you today. We are absolutely delighted to kick off this webinar series that we've been talking about for some time, in which we're going to feature KP Center past and present grantees who are going to speak about the influence of research on their work. We can go to the next slide. So it's been our privilege to witness the first grantees of this center create impact on a wide range of firearm-related topics. From suicide prevention to community violence intervention, our grantees have shown creativity, they've shown resilience, and they've shown commitment to doing this work. These are really challenging times to do work in this space, but we've navigated those challenges, and our grantees have moved projects with both local and national impact. So over the past few years, we've heard a lot of meaningful insights from grantees about the importance of research to advancing a public health approach to violence. And every single one of the grantees in our center could speak to this critical topic. Our presenters today are intended to represent a range of types of projects, categories of grantees, geographic regions, to hopefully provide a snapshot of perspectives on the ways and on the impact of research on different kinds of violence prevention and intervention. All of our grantees have inspired this series as they've given us their insights on what would be most helpful to reduce gun violence and to advance gun violence education in this space and to move this work forward. And it's for our grantees and for the field that we created this series. So we're really pleased to be kicking it off today. Next slide, please. So I'm really excited to be introducing our presenters. Each grantee is going to give us today an overview of their project very briefly, and then just speak for a few minutes on why research is important to them and why research is important to their work. So I'll introduce each speaker as we go, and at the conclusion of their brief talks, we'll have an opportunity to ask some questions about their experience and some of the lessons that they've learned from doing this work. So I just want to remind our audience, we do have a Q&A feature, so we can pose some questions to our grantees as we go along, so please feel free to use that. We may not have time to answer every question, but we'll answer as many as we can. We'll incorporate that into our conversation as we go. So let's begin. We can actually take the slides down, and we are going to begin with Dr. Regina Miranda. So Regina Miranda is a professor of psychology at Hunter College and directs the Laboratory for the Study of Youth Cognition and Suicide. And she's a faculty member in the doctoral training area in health psychology and clinical science at the Graduate Center of the City University of New York. Her research focuses on understanding why young people think about and attempt suicide in a way that can inform assessment, treatment, and prevention of suicide risk. She is a 2023 Research Scientist Grantee, and Regina, I'm going to pass it to you.
Thank you so much for the opportunity to talk about the research in my lab. So as Ruth mentioned, my work focuses on trying to understand why young people think about suicide and attempt suicide, but also to use their lived experiences to understand when they do think about killing themselves, what is it that young people actually think about and how they think about it? And can that information, what they tell us about their suicidal crisis, can that improve our assessments of risk? So one of the projects that we are working on is to try to develop an interview-based way of classifying teenagers' suicidal thoughts. And so some recent findings that we currently have under review suggest that we can tell something about how imminently a young person is at risk of attempting suicide. So whether they're at risk of attempting suicide and how soon they are, how soon they'll attempt suicide if they do attempt suicide, based on how we classify the ways that they describe their suicidal thoughts and the persistence of their suicidal thoughts. So how frequently they report thinking about suicide in the 30 days before they present to the emergency department or a crisis setting with suicidal thoughts or suicidal behavior. Other work in my lab funded by this project is also supporting the work of my doctoral students who are trying to develop better ways of engaging families in the emergency department, because many of the settings that we work in they're public hospitals and lower resource settings. And there's a gap between when families are discharged or when teenagers are discharged from care and actually engaging in treatment. And so one of my doctoral students, Sarah Sullivan, is trying to understand families' experiences in the emergency department following a suicidal crisis and what could be improved about those experiences and how they might be able to engage in treatment and also foster better experiences of disclosure, of suicide-related disclosure among teenagers. And then other work in the lab has been by another doctoral student, Felix Yerdong, has been looking at social connectedness and what teenagers describe about what they anticipate about others' reactions to their suicides, and what that tells us about their degree of social connectedness within their social networks and potential suicide-related risk. So that's some of the work that's being funded by this grant, and why this is important. We know that suicide is one of the top 3 leading causes of death among adolescents and emerging adults or young adults. And we also know that suicides are hard to predict. There's a higher suicide attempt to death ratio. We know that about 1 in 5 teenagers, for instance, thinks about killing themselves in a given year, and about 1 in 10 reports attempting suicide in a given year. We also know that suicides are very difficult to predict among teens, and that's partly because many teens who think about or attempt suicide won't tell somebody that they've thought about or attempted suicide. In fact, we know that there is a low agreement rate between what teenagers or young people report about their suicidal thoughts and behaviors and what their caregivers report about their suicidal thoughts and behaviors. And so one of the things that has prompted in the field is trying to develop other ways of assessing suicide-related risk that doesn't involve directly asking young people about their suicidal thoughts and behaviors. So using AI or machine learning or other forms of technology-based assessments. But one of the problems, and while that might be a promising area, one of the problems that I argue is that over the past 20 years, that has led us to not actually speak to young people in detail about what it is that they're actually thinking about when they're thinking about suicide and what leads them to do so. And so why our research, work is important to me, is that it seeks to actually leverage the lived experiences of young people with suicidal thoughts. And in that way, also destigmatizing asking very detailed questions about someone's suicidal thoughts or behaviors, because that's also something that even as clinicians, we can be wary of delving too deeply into. And so what the work that we've been doing for the past few decades suggests that it's actually helpful and feels supportive for young people when someone asks them very detailed questions about their suicidal thoughts and the nature of their suicidal thoughts and behaviors. So I think that's it in a nutshell.
Thank you so much. I love what you said about social connectedness and the relationship between that and how we actually talk directly to young people about what they're experiencing. It's such a relationship-based piece of work that you're describing, and I really appreciate that. So thank you so much for that. I am going to move on to our GRASP team. So I'm going to introduce Johnnie Williams and Virginia McCarthy. Johnnie Williams is the Executive Director of the Denver Youth Program, which orchestrates many programs, including the At-Risk Intervention and Mentoring, or AIM, Hybrid Hospital-Based Violence Intervention Program, the Gang Rescue and Support Project, or GRASP. And Johnnie leverages positive youth development at the service of what he believes to be the most rewarding outcome of his work, supporting youth as they change their lives for the better and becoming the fullest version of themselves. Johnnie and the GRASP team are 2023 community-based grantees. Virginia, or Ginny McCarthy, is an assistant professor in the Department of Surgery at the University of Colorado School of Medicine and an affiliate faculty of the Firearm Injury Prevention Initiative and the Injury and Violence Prevention Center. Ginny works closely with the Denver Youth Program and with GRASP as the director of the REACH Clinic to support holistic healing for individuals who have been injured through community-based interpersonal violence. Ginny's research and practice prioritize multi-sector collaboration, qualitative research, and community voice. Thank you both so much for being here. I'll hand it to you.
Great. Thank you so much, Ruth. Again, just a quick overview of our project with the many wraparound services that we provide in our DYP, Denver Youth Program. One of the things we realize is that our young people, when they are wounded or their traumatic injuries, they don't want to go back to the hospital. So we wanted to provide an opportunity for them to do community-based healing. And my partnership with the university had an opportunity to meet Dr. McCarthy. And when she was doing her dissertation, she came to me and she asked me about doing research. And I said, no, we're not doing that because we've done that. Our community is researched. We do mapping. They come and they ask questions, and they are very intrusive about the questions they ask and how they ask the questions. And then they never do anything with it, right? We know research is important, but we never understand as a community what happens with the research after that. I said, we have photos and photos of interviews that we've done with our communities and nothing ever happened with that. So, and then Ginny said to me at that particular point,
yeah, if I had to find my unmute button, but I said, Johnnie, here's the thing. The research that I want to do, I look at it differently. My perspective is different. I'm coming at it from that academic perspective, but I prioritize and champion community voice. But here's the thing, if we can change the approach, not just change the voices that are going into research or the questions that are being asked, but the voices that are asking the questions in research. And community engaged research isn't new to anyone on this call. But if we can train our team as researchers, not to engage in research, but to actually lead research, we could change the narrative, not only on what we're finding, maybe we find similar things, and that's just fine and good. But if we can find a way to ask questions differently, if we can find a way to analyze these questions, analyze these data that we're getting through qualitative research with a team of frontline professionals who are trained in violence intervention and prevention, but who are also trained in research. So we're not bringing researchers together with violence prevention professionals, but instead researchers are supporting and lifting up and building that capacity within frontline professionals to carry that research forward.
and that was very important because we were embarking upon this new project that is funded by the KP, that we were having to make sure we understood that the community, what are the needs of the community around being able to come in and get bullet-related injuries or traumatic-related injuries taken care of in the community-based clinic versus having to go to the hospital. So it was very important to us when we had conversations with the clientele and with our neighborhood and with our populations that we served, that we were meeting their needs, right? So the other thing was about research is we're not going to just do research and then don't come back and do anything about whatever the findings that that we have. So we made sure that not only did our team embark upon having these conversations with the community, but we were making sure that whatever we found from the research that we did, the data had to inform the work. The data has to inform the work. And that was the REACH Clinic and the Brick-Related Injury Clinic partnership that we came up with. And we're doing brick boxes in the community. We found out what the community need. And every Thursday, we provide not only the wound care, but we have a lot of young people and people that are in our neighborhoods that they need food. So we do food. They need clothing. So we do clothing. They need help signing up. Yesterday, in the middle of a meeting, I had to leave the meeting and go help someone get their Excel turned back on. So there's wraparound services in the project that we have, but we had to research the community to find that out. And then Jenny can talk about how that kind of played out in the model that we have.
Yes, and so I think we'll leave you with a little bit of a teaser for maybe the panel questions on what impact this has made in the community and how the REACH Clinic and this distribution of brick boxes has facilitated this multidisciplinary care, but also has been informed by community-led research and informs the next projects that we are carrying forward with our VPP-led research team. So thank you for the opportunity to share a little bit about the project. We're so grateful for the support, and we'll maybe talk a little bit more about that in the Q&A.
Thank you both so much. I am really wanting to underscore your description of involving community voice from the development of the question to dissemination, that whole process. That's really powerful. So thank you for sharing that. Candace, I'm going to move to you. So Candace Hester, Dr. Candace Hester is a principal researcher at the American Institutes for Research, or AIR, and in her decade-long tenure at AIR has worked on dozens of rigorous and deep evaluations to examine the capacity for cross-sector collaborations to engender justice, resilience, safety, and thriving. Candace is a 2023 Research Scientist Grantee, and in recent years has participated in 3 separate projects that focus on gun violence reduction, youth diversion, and building the CVI ecosystem. So Candace, I will hand it to you.
Yeah, thank you so much. It's such an honor to be here today, and I was really inspired by the remarks of the speakers that came before me. A lot of what we think about at AIR is how we can bring the diverse assets that we have within the institution and really marry them with the assets that our partners are bringing, both often who are serving in some sort of training and technical assistance capacity, and as well as within community. So what Johnnie and Jenny were just talking about really speaks to me, as well as Regina, about trying to understand the context and leverage the voices and assets of the individuals with the community to really inform the work from design through dissemination. A lot of our approach is around trying to understand ecosystems and the ways that different systems are facilitating solutions, but also need to really be coordinated to really wrap their arms around an individual to kind of break cycles of trauma and serve them better. We see a lot of overlaps and then giant gaps in how systems currently serve. And if we're going to really make systemic transformative change, we need to address that from a systems approach, which is why a lot of our work ends up supporting intermediaries. And so one of the projects, for example, that we're supporting is with the Coalition to Advance Public Safety, and the intermediaries on that project are the HAVI alongside the National Institute for Criminal Justice Reform, the the Community-Based Public Safety Collective, and also Cities United. And that project really embodies this ecosystems approach. So they're each trying to serve a different kind of systems partner, whether it's connection to police, connection to community, connection to city offices, connection to hospitals, and thinking about how we can better collaborate and coordinate those supports so that we're really thinking about how to serve community and elevate and center community in that approach. So we're thinking about a mixed methods strategy. I think a lot of the assets that we have within AIR that position us well to do this work is that we're bringing together individuals who are trained in ethnography, trained in participatory methods, trained in traditional, qualitative, deep, in-depth methods alongside our rigorous quantitative methodologists who can bring to bear as array of quasi-experimental and experimental designs. And we try to, work with community, work with our partners to think about which of those are best suited for each individual research and evaluation project, and then how that can bring, a fuller picture to all of the work, to the field, to think more about the ways in which we can expand our understanding and work together collaboratively to make transformative change. So I can say more about any of those projects, but yeah, I think that's kind of the overall approach that we're bringing.
I really appreciate that. I want to lift up, each of you are saying so many pearls, but I really want to lift up this concept of serving community by impacting systems through research. And so you don't want the research that you do necessarily to just stay in community, even though it needs to get back to community. You want it to impact the systems that ultimately are serving those communities as well. And that ecosystem approach really speaks to that. So thank you so much for that. So
I think you're on mute.
Oh, there we go. Thank you. So Lisa, you are up next. So Lisa Wexler is a research professor in the Center for Research on Group Dynamics in the Institute of Social Research and a professor of social work at the University of Michigan. Her work supports community learning, dialogue and action, and creating hopeful opportunities for prevention, innovation, and respectful interventions to prevent suicide and at-risk substance use and to promote wellness. Lisa is on the research team for the Family Safety Net Initiative, developed in partnership with local community to create a culturally affirming brief intervention to address firearm access in Alaskan Native participants. Family Safety Net is a 2024 grantee in Category 2, which was awarded to programs seeking to expand evidence-based interventions. So Lisa, I will hand it to you.
Thank you so much. And I think there's a slide that goes, am I supposed to share it or are you gonna? Oh,
we can throw that up.
Okay, yeah, that's what I thought. Okay, great. So thank you for introducing me. And I want to give a shout out to Manalik Association, who I've partnered with for actually decades now. This is probably my third decade of partnering with them. And we, over time, have really noticed that our typical mandatory hospital screenings were not catching very many people. And those that it did catch, that's like the PHQ in a hospital setting, were only really hitting 2% of the people that were coming through. And in the regions that I work in remote Alaska, youth suicide is one of the largest it's the highest, it's the number one reason why young people are dying early. So it is a really important thing. We can estimate that about a third of folks, as Regina mentioned at the beginning, are having suicidal thoughts at one time or another. It's developmentally kind of appropriate if we think about some of those milestones in development. And yet we need to have some less punitive ways to respond. So what we have done is trying to shift, looking at community strengths. One of the things that's really important to the Inupiaq people that I have been serving and been engaged with for a long time is a very family-focused lens. And so what we've tried to do is to come up with a system of care that really engages family members in making their homes safer. So we know that lethal means reduction or making homes safer, especially when firearms are the number one killer, suicide killer in Alaska. If we can make it harder, make it take more time to get a loaded gun, we know we can save lives. And so what can we do to partner with families and communities in a universal way to make homes safer? So that's what we tried to do. So I'm going to walk you through this slide, starting from the left, moving to the right. We piloted through NIMH and CDC, we piloted this idea of using a screening for family members. So these are adult family members where we're asking in the past month, has someone in your home seemed sad, down, and depressed? And are you worried that someone in your home is at risk of suicide? If they answer yes to either one of those, we invite them to be part of a conversation where they can get resources to keep their loved ones safe. And this image of a house looks like many of the houses in remote Alaska. We walk them through it using a motivational interviewing informed script, where we talk about 988, we talk about the importance of home safety in locking up guns and making sure medications are a little less accessible. And we give them equipment that they can use to do those things. So we give away medication boxes, ammo boxes, gun locks, and we send them really supportive text messages after that that are done through an automated system where we're really appreciating their intention to take care of family members, where we're reminding them of some of what we talked about in these sessions. When we did that in more of a health care or a health fair kind of a way, we tried that out with other kinds of support, and we found that people were very excited about the intervention. It was really positive. It gave them more tools to do what they already wanted to do, which is to keep their loved ones safe. It used an evidence-based intervention, which is lethal means reduction, in homes that on average have 7 to 9 guns. So if you think about the importance of just locking up guns in those communities, really, really important, but to do it without forcing anyone to do anything that they don't want to do already is a really important thing. What the Kaiser Foundation has been helping us do is to try that in a clinical environment, which we were not able to do because we got previous funding through NIH during COVID. So we got that in 2020. We were one of the first waves of folks who got funded for firearm research. And so we've been able to take this idea and move it into a clinical setting in Maniluk Health Center, to really see how many people were screening in. When we did it in more of a health fair kind of a way, we were getting about 30% of people that were screening in to this. So answering these questions in the affirmation, yes, I am worried about somebody. When we do it in a regular everyday clinical primary care setting, we're finding a lot less than that, about 10%. So it was really important to see about the magnitude if we were going to scale this kind of thing. Also, we wanted to know what kinds of resources people were taking, because when we did it in a health fair kind of a way, people took a ton of stuff in a clinic with really limited space. Having a ton of stuff at the ready is really hard, and it involves a whole resupply chain. So the Javi is really helping us figure out the supply chain issues, trying to figure out how hard is it for outpatient nurses to ask these questions, to get the answers, to refer to a community worker who can then walk them through a lethal means safety or a helping make your family member safer intervention. So we've been finding out so many things that are absolutely essential to putting this thing into a clinic for regular practice. So we're really, really appreciative. Happy to be here. Happy to answer questions. Thank you.
Thank you so much. And you're the second one to mention the treatment of the family. You're considering the entire family unit in an intervention where you want to impact an individual and ultimately a community. So we really appreciate you elevating that for sure. All right, so David, you are next. So David Leopold is the Chief Evaluation and Learning Officer for Uncornered, and in this role, he oversees research, evaluation, and learning strategies for the organization with a focus on participatory and human-focused methods. David has 10 years of experience leading community research projects and managing impact work for Boston area nonprofits. Uncornered is a 2024 grantee in Category 3, which was awarded to research questions that would shift and inform how the field understands and approaches gun violence prevention and intervention. David, I'll pass it to you.
Thanks. Hey, everyone. Appreciate you all being here. And then thanks for the ability to do this with you all today. I am going to try to keep it short. And I do have a little slide here that will just help give some context to everyone. So the work of Uncornered, we are a national violence intervention organization based in Boston, Kansas City, and Providence. It is our work, and we strongly believe that we can bring an end to violence in our cities across the US, not alone, but as part of a robust community violence intervention ecosystem. So if we're starting on the left of this slide, we also do all of our work through the lens of social network theory. So we also know that the individuals and the networks that are driving violence are responsible for anywhere from like 50 to 80% of the violence in our cities across the US. That is specifically our work, is to engage these networks and engage the drivers of violence and engage them in peace building activities. And what's really unique to Uncornered is that we are not providing and saying that we're going to help these individuals. We are going to these individuals and asking for their help in helping us understand and learn how to be a peace building movement and organization. While we greatly appreciate and care deeply about individual impact, everything that we do is about impacting the networks of core influencers, who you see in the top left-hand corner here. So our work with Kaiser, who we're just incredibly thankful for this funding, has been an emphasis and a focus on our learning work. And it's primarily focused on a exploration of our networks that we're able to engage with and then collect some incredible data on. And the second part of that is to then, after we've done that exploration, help us and help the CVI community understand how our approach to social network theory and how social network theory in general impacts violence levels in the city where we're located. And thirdly, how other organizations, how other individuals and groups in the CVI field can use social network theory to reduce violence moving forward. Everything that we do at Uncornered has a goal of learning. We're very, we are very, have a huge emphasis on learning. And we have a saying that's, if you're not learning, then it's not Uncornered. So if you look in the top right here, everything that we do from a learning perspective involves our core influencer networks. These are our participants. These are the guys that are driving violence in our cities. And we do not just go out and get information and insights from them. They are in the center and the lead of research, evaluation, and learning work. So they know from day one that their role with us is to learn and share and help us all learn. And that means also having people on my team, the learning team, that are core influencers as well. So I can say a little bit more about that when we're moving forward later in this webinar. But again, happy to be here and happy to answer questions and share with folks.
Thank you so much, David. And what I hear you saying is that they are, and it's represented in that graphic there, they're the center of the model. They are driving down violence by virtue of what they know, by their expertise and lived experience. They're not being acted upon. They are the actors, and they're the ones who have the power in that model. So I just wanted to elevate that feature of Uncornered's work because I think it's incredibly important and really aligns with what we've been hearing from others about how the models that work really center the communities that are most impacted. So thank you for that. All right, I am going to move to Kendra and James. Thank you so much for being here. I'm going to introduce you first. So Kendra Vandewater is co-founder and co-CEO of Youth Empowerment for Advancement Hangout, or YEA Philly, a nonprofit focused on empowering young people in Philadelphia impacted by violence to achieve the lives that they want and simultaneously reduce youth and community violence. Kendra lives with the belief that challenging oppressive systems creates sustainable change. Her life's work is to improve the quality of life for people, starting with communities and ensuring policies are representative of the people impacted. And James A. is also co-founder and co-CEO of Yeah Philly. His expertise is ensuring people who continue to be impressed or oppressed by systems have access to cultural and quality supports. James has assisted thousands of individuals with various supports to help them thrive, connecting young people to sustainable support systems. Yeah Philly is a 2023 community-based grantee, and I will hand it to you both.
Hi, everyone. It's nice to see you all.
Hello.
And
Thanks for having us on this panel. And it's interesting. I see some of the folks that I met a while ago while doing my hospital-based violence intervention work. But with our work, we've really shifted to learning and understanding from young people who have been charged with a violent or gun crime in Philadelphia. A space where we know that while there is a lot of research on trying to understand why, there isn't enough community-based resources to actually work with those young folks. So a few years ago, Kendra and we developed our core component, which is our violent crime initiative, which works with young people 15 to 24 who have been charged with those violent crimes. And that stems from, just a gun crime, which typically isn't eligible for diversion if you're a young person in Philadelphia, stemming to charges up to as homicide. With our work, what we do is we work with young people who are in the system, incarcerated, or have recently been released from being incarcerated by providing them holistic support. And that comes from working from the foundation of, the support and service that they were never given, those opportunities they never received, which led to, some of the mistakes that they probably were accused of or involved in. Through our work, we've been able to support on average about 500 young people per year. And if you think about that number in Philadelphia, there's about 500 young people per year that, are charged with violent crimes. So through this work, Kendra and we've been providing holistic support and services. And Kendra talk a little bit about what that looks like and how that correlates with not just research, but just overall wraparound services.
so we serve about 650 per year now, but the ones in our violent crime initiative, we've been able to serve almost 200 individuals out of the 500 total who are charged with a violent crime. And so for us, what that looks like is identifying needs, putting young people at the forefront of their own treatment and interventions and offering them opportunities. And so since this initiative is the first of its kind in the city who have supported this population, the way that we do this work, we have a legal team that meets young people wherever they are. We have attorneys on staff that may represent young people if they are not okay with their current representation. We have legal coordinators and advocates, and the largest component of our violent crime initiative is the advocacy in court, because a lot of times young people do not know what is going on in court. They don't know what's going on with their case. They don't understand it. And so that process is the most important. Now, over the past 2.5 years, we've been working with Temple University to do the research around the successes of our program. And we've also been partnering with the Department of Public Health of the city. And we've been doing safe storage research around distributing gun locks and gun safes, but collecting the data around why it's important for people to receive these safes and these locks. So it's been nice to see this, because a lot of times the research is not being done in communities that look like ours. They're not being done in urban communities. And so we're producing research that is new, and we're hoping to inform the field around not just violence intervention and prevention, but also safe storage initiatives and how we support young people who are charged with a violent crime in our city.
Thank you both so much. I think when you think about reaching one young person and the ripple effects of that, it's so much more than the one person you interact with when you influence their families and their networks, et cetera. And so when you think about your reach in Philadelphia, it really is very moving and very compelling. So thank you both so much for sharing. And we're going to transition now to some question and answer. I know that there are some questions that are going to pop up in the chat. I just want to encourage people to use the Q&A to submit any questions that you might have. We'll try to incorporate as many of those as we can. But I'm going to start with, Lisa, I'm going to ask you a question first. You had alluded to practices that you've learned that have emerged as critical to your project that you learned along the way. Can you name one of those? Can you talk about that?
Sure. I mean, one of the things in working in a clinical environment is, well, it's probably true for all different kinds. I usually do community-based participatory research in community, and so a clinical environment was new. The use of time and responsiveness was kind of really important. So being able to very quickly respond to requests, assuage fears, being able to like produce things as they were asked was really, really important for us to have clinical partners that were willing to actually partner with us because they're completely like pulled in a million directions. They have no time, they have no space. They have a lot of different people asking them for things. And so when we were asking them for things, we were also bringing them things and responding to anything that they had said the last time that we met. And that sort of super responsiveness, hyper quick, sort of outcome-oriented results. When we met with them, we had all of our ducks in a row, so we could give them exactly the information that they wanted. They could find it easily with the materials that we sent them. They could see our larger plan and where we were at. We were always sort of looking at our sequence of things that needed to happen. And all of those things were both reassuring to them. It allowed them to say yes more than no, which I think is an important thing for clinical actors who are trying new things in the middle of a context where they're already really stretched. So those were some of the practices that we, in community, I found relationship building and slowing it down is more important than some of these other things, but like using time really well for our clinical providers were really, really important.
Yeah, that's really important for those doing work in the clinical setting. Thank you for that. Kendra, my next question is for you. What do you think limits the ability of gun violence prevention advocates and practitioners to combine research and practice?
I think it's multiple things. So what we know is that when advocates want to do the research and the practice, there's limited capacity related to staff, there's funding restraints. I think about the research that we do. The first 2 years of research with Temple cost almost $300,000. So when you think about the average advocate who wants to do research and practice, it's very expensive. And so the time and the funding constraints are the biggest challenges from what I see.
Appreciate that. I'm going to ask David, I'm going to ask you the next question, which is about research partners. So who have been your most critical research partners and contributors?
Yeah, it's a really good question. And I think we've heard it from a number of folks on this call so far today. But for Uncornered, like I had mentioned before, we use a participatory and empowerment-based learning, research, and evaluation approach. And for us, like, we wouldn't be able to learn, we wouldn't be able to know what we know, or even just ask the questions that we think will help us find a solution to violence or ending violence without core influencers. And someone asked before, but core influencers are either current or former drivers of violence. This is just a term we coined or made up basically like 10 years ago to just help easily define it for ourselves and for others. So they are the drivers of violence in cities, and not just like someone that's around violence, but they're shooting people. And we believe strongly that it's those individuals that can unlock a thriving city because they've never been engaged in a way that allows them to actually be peace builders. So for us, the most critical research partner or part of this research has been putting core influencers at the center of all of this research and all of this learning. Some of the questions and some of the information that we ask and that we're learning on a daily basis is just incredibly sensitive. And like I've been doing this for about 10 years now, and just kind of embedding myself in, in cities and in gangs, and trying to understand the nature of violence. And I've never been able to collect like the complexity and the level of like amazing data that we get from guys just by having core influencers on my team, specifically on the research. And in addition to that, they are able to just engage these guys because they are part of their networks already. And we're just asking them for their help in learning. And we are like, I can't state this enough, but we have our very formal research that we do, and then primarily our learning work is just rapid and really informal, and we're just constantly recycling what we're learning, taking the data from that, and putting it right in the hands of our core influencers.
Yeah, you're really speaking to this concept of community engaged. Candace, I was going to ask you about how, because you worked on a number of projects, what it looks like to you to engage community, both in the research itself, and then what should it look like? So what has it looked like, and what should it look like to engage community meaningfully?
Yeah, we've done different kinds of community engaged projects. We have a youth participatory element to the diversion project that we're working on in Oakland. A lot of our projects feature community advisory boards or some kind of stakeholder advisory group with kind of a broader array of folks who might want to engage maybe at the systems level as well as the community level, for example. And a lot of that really reflects a lot of what Lisa and David just talked about, trying to create as many different ways for people to provide feedback, to oversee, and being really responsive to what you hear in a way that shows them that you're listening and that you care, and that you are their true partner. You're interested in sharing power and elevating the voice. And there's certainly tension that can go on with that. One of the things that David talked about, or maybe it wasn't David, maybe actually it was Johnnie, I'm not sure, but I can't remember who said it, but is thinking about ways to, Jenny, I know it was Jenny, training individuals who are part of the work themselves, like using the research process as a part of their shared professional development. So they're able to show up in kind of multiple roles through the project, both as, let's say, life coaches to facilitate the work, but also as people who are responsible for gathering the information and supporting the analyses activities directly. So it's through their lens that the work is being filtered as compared to through our lens. And that really is a way to share power, to contribute to community by providing professional development services. And the other thing that AIR has started to do since 2022 is, because of a lot of our work is about breaking cycles that funnel through the criminal justice system, is we've created a number of pathways through which individuals who have lived experience in the system can enter the institution, either who already have research or training and technical assistance expertise, or who are in the process of working on them. And then they directly support various portfolios of work and help us define just internally how we enter the research space and think about what our assets are, what are the really hidden parts of the work that we're not attuned to, because many of us ourselves haven't gone through that cycle personally.
Yeah, I appreciate that. I think, and just to stay with this theme, Johnnie, you had mentioned part of what gave you pause early on about research was it's been done and it hadn't yielded anything that looked like impact back in the community. So I'm curious if you've seen, or you can speak to ways in which you feel that you've seen research do that, really start to turn around how the practice evolves and how communities actually get better outcomes as a result.
Actually, I have. I think that the first change that I saw was how my staff interacted with their clients and actually with administration because once the staff understood that the data that we gain from research is what we use to sustain and build our programming, then they saw the importance of it. And then also with the community itself, they felt like their voices were heard and that they were being seen, because organically, after we did a project, we were able to actually then go and change the outcome of what was happening in the community. They actually saw direct results of the data that they shared with us. And then us standing in a space, we had the mayor's office call and asked us, can we get a bunch of people together so they could do interviews around carrying? And we said, no, we can't do that. But what we can do for you is we can let our staff do the interview for you, and we can provide the data for you. And then we need to know what the dissemination of this data is going to be and what the outcome of the project is going to be, so we can let the young people that we're working with know that on the other end of this, something is going to happen, right? So now we're standing in a space that's saying that we're no longer going to provide you subjects to be researched upon. What we're going to do is find out what you need, and we're going to give you the data after we do it in the way that our new model predicts that it needs to be done.
Yes, the word I'm seeing when I hear you speak is accountability, and how researchers have to be accountable to the individuals that they and the communities that they do research in and about. And so I really just want to underscore that. I think that's extremely important. Staying with the work of GRASP, I wanted to ask about practical advice, Ginny, that you would give someone who's just starting. So who's where you were at the beginning, just starting to think about starting a project. What would you advise?
Yeah, absolutely. I think that one of the main things I learned, and this has been said before, so to echo it again from others' wisdom, is to take the time to slow down, to ask the grounding question, follow that guiding star that's that shared point between community and academic researchers, because without that grounding, we get lost. We get sucked into what funders want. We get sucked into what academia does and continues to do. We don't hold ourselves accountable, like you said, Dr. Abaya, to what community wants and needs and what that community focus is. The other thing I would say is that thinking about the ways in which we can empower and integrate into the healthcare team and influence that clinical setting with community voice and perspective will foster more trust. And so understanding the role that research can play in unbreaking that broken trust is one of the key lines that the bullet-related injury clinic uses in St. Louis that we've adopted as well. But unbreaking that broken trust in a clinical setting through community wisdom and allowing community to broker that trust and integrating that into that clinical care that individuals provide. So to think big, to say this doesn't have to be because it's work done in the community for the community. If it doesn't get into the clinical space, it doesn't rebuild some of that broken area that will foster violence intervention and prevention over time.
Right, absolutely. Yeah, I really appreciate that. I'm going to actually pose a question to you, James, about along the same lines. Like what's a lesson learned / something that you would say to someone who's just starting out? If you could pull out one lesson from your experience, what would that be?
So this you'll get a two-punch combo from me and Kendra, because there's a lot. But we weren't, so this is coming from, so we weren't a grantee, you know,
For the research.
for the research component, but I can say that we always have to remember that the people closest to the problem are usually the closest to the solution. And I know Jenny mentioned some of that, Johnnie mentioned some of that, but we still have to, use community and, trust them and give them the resources that they need to be part of it. I also think about um, even like the universities and the hospitals, it's vital and it's important that, this work has to be combined with those institutions. You have to use community in order for it to be impactful. And not just talking about it, but just bringing community to like the core, like giving them real power. Because they will show up, they will lead, and they will shift the narrative. So the biggest lesson is that, listen to the community and be specific about that community. Fund our ideas directly, and stop assuming that an evidence-based approach for one community will work for another.
Yeah. And I think about when we have institutions come to us, or we have students that come to us from a class and do internships with us, their major project is to do a community assessment. They will come to us and say, oh, well, we want to do this in West Philly because we don't think that people really care about gun violence. I was like, where did you learn that from? So they're coming with these preconceived notions of places that they've never even assessed or talked to people in. And so a community assessment of observing and talking to the people that live there and knocking on doors and understanding the environment before going in and saying, this is what I want to do, is the most important thing. Whether you're starting out, whether you're not, that should always be your first step.
Yeah, very well said. I'm going to uplift a question from the chat that I think is a great way to tie all of your excellent work together. And so the question was about those who do community violence and whether they do any work related to suicide prevention and intervention. So I don't know if there's maybe one of the folks who do a lot more in the community violence space who want to talk about anything that they do in the suicide prevention and intervention space as well.
I can just say that it's a mindset. So suicide and homicide are so closely connected. What changes is opportunity and actually access and where you are and what you're doing. So we definitely, with all of the violence prevention work that we do, we definitely focus on suicide because we know that any of our young people that are struggling in a mental health episode, if they are not alone and they're around people and they're having an episode, those people could become victims. And if they are by themselves and they can't get to people, then they become their own victim. So we definitely focus on suicide with all the work that we do.
Appreciate that.
I'm sorry. And for us, while we don't focus directly on suicide prevention, all of our initiatives tie into like mental health. And a big piece is our safe storage initiative. While we know, firearm death is one of the leading causes of death, and suicide, obviously. But we also learned that you can't tell a person to give me your firearm back and I'll give you a gift card for $200 just to buy you 2 items from the market. But you can say, how about I give you $100 digital safe where it looks cool, that maybe you should just keep that stored in there to prevent anyone from having access to it. And then sometimes, like some of the folks who do have access to it, they forget their passcodes to lose their keys, and that kind of just limits even more access. But a lot of what we do is tied to the mental health component. So I would just share that piece, but it's a difficult fight.
Yeah. Yeah, I feel like you and Johnnie are both talking about the relationship, in general, the wonderful intersection when you're dealing with someone's mental health, how it impacts all the different manifestations. Thank you for that. So I want to be sure to lift up some next steps. This was a fantastic panel. Thank you all so much for being here. Thank you for sharing your insights and your work. We know that you bring a lot of heart to your work. We appreciate you sharing that with us as well. We do want to talk to you all about the next webinar, if we can put up that slide. So we are thrilled to announce the next webinar in the series. So that's going to be at the end of October. It's titled From Problem to Purpose, Choosing Research Questions That Drive Change in Firearm Violence Prevention. Dr. Ali Rohani Rabar and Christina Umali are going to be our research and practitioner-based presenters for this first series. And it's really about one of the most important early stages in research, choosing the right question, which you heard a lot about today. So thank you all for joining. We ask you to please stay on for just one moment when this ends and do the survey if you can. We'll also send a follow-up email and we'll send you registration information about the next webinar as well. We did see that there were questions in the chat we didn't get to, so we're going to save those. We hope to continue to find ways to facilitate connection between our attendees and our wonderful grantees. So thank you for all the interest and energy that you all brought to this. It's really been an honor to share space with you. Thank you so much. Bye.
Thank you, Ruth.